Hello, I'm Dr. Jim Hoyt. If you're new to our office, welcome. If you've been here before, welcome back. A few words about health insurance and fees for health care. It used to be, to visit a doctor, you'd wave your insurance card, sign a few forms, and the bill is pretty much paid for. But times have changed. We often hear media coverage covering politicians debating about the cost of health care. The fact is, if you read the fine print in your policy, it's already affecting you. Insurance benefits are shrinking. You are being forced to pay more for care out of your own pocket. Medicare is affected as well, especially with the implementation of Obamacare. We work very hard to stay on top of changes with insurance, especially Medicare. Please remember, I'm just the messenger. I have no control over what Medicare requires. We simply try to do the best we can to stay in compliance with Medicare regulations. There is no question that Medicare is confusing. That's why I put together this presentation to make it a little bit more understandable. Don't be afraid to ask questions, because even the greatest minds in the world would be confused by Medicare. About Medicare chiropractic coverage. Periodic guideline updates from Medicare require us to change procedures in our office from time to time. I want to take this opportunity to explain or clarify Medicare coverage for chiropractic. This may be different than what you were told before, whether it was here or at another office. And yes, Obamacare is already impacting Medicare. Your Medicare coverage of chiropractic care is limited. Coverage is limited specifically to manipulation of the spine when it meets Medicare's rules. There are two categories for this, usually covered and non-covered. Let's talk about usually covered services first. A typical example of a Medicare covered service is when you are injured or you are in a lot of pain due to a bad spinal condition. You should expect Medicare to pay for your rehabilitation as long as you are improving. This phase of care is called active treatment. It will be shown in your Medicare claim form and payment reports with your service code, for example, 98940-AT or 98941-AT. Typical Medicare treatment episodes. An episode of chiropractic care for Medicare treatment is defined as active treatment for an acute condition or an acute flare-up of a chronic condition. A new acute condition may require 12 to 18 treatments, while an acute flare-up of a chronic condition may require 4 to 6 treatments to stabilize. Pain assessment and functional outcome assessment. Beginning in 2013, the Patient Protection and Affordable Care Act, commonly called Obamacare, has made participation in Medicare's Physician Quality Reporting System mandatory. If this is not done properly, Medicare will not pay the full amount or may not pay at all. Again, this is mandatory. Nobody likes doing paperwork, so I've done everything I can to simplify this process. Why is Medicare doing this? Medicare will utilize this information to compare health outcomes from various types of treatment or interventions. In the future, more emphasis will be placed on the best treatment approach that results in the best health outcome for the patient. Pain assessment. I've tried to make this as easy as possible for you and me by using a kiosk, a touchscreen computer in the front of the office. We will show you how to use it or do it for you. You will be asked to rate your pain severity for each major complaint from 1 to 10, with 10 being the worst each time you come in. This will help reduce paperwork and keep better track of the information we need. Functional outcome assessment. This consists of common patient-understood language utilizing measurement of patient experience related to their complaints and how much it impacts their daily activities and lives. This measurement is important to show goal of care, progress or lack of, compliance with care plan, comparison for the purpose of pre-existing complaints. The bottom line here is we want to reduce pain, but our purpose is to help people function better. For example, a goal of care might be to improve a patient's daily activities by 50% over the next 4 weeks. This can be monitored and measured as the patient progresses with care. When are these assessments performed? The pain assessment is performed on every visit, while the outcome assessment is performed at the initial visit, giving us a baseline reading, and then a follow-up visit or re-exam within 30 days, at times of exacerbations, and at the conclusion or discharge of care. How does Medicare determine if they will pay? Each episode requires an exam to document the need for active treatment as it arises. If we don't document it, charge for it, and show the need for active treatment, Medicare will not pay, stating that it is maintenance therapy, making you responsible for the total bill, not just the exam fee. How do we document this? Examination of spine with a chiropractic PART exam. P is for pain, A is for symmetry or alignment, R is for range of motion, T is for tissue tone changes. Now let's talk about non-covered services performed by a chiropractor. Before we get into that, I just want to say that just because Medicare does not pay for something doesn't mean you don't need it. For example, services provided by an optometrist or dentist are not covered but are still necessary. All examinations performed by a chiropractor are not covered by Medicare, yet they are required to establish a need for treatment, and by Medicare rules must be billed to the patient. Extremity adjustments, x-rays, laser therapy, acupuncture, those are not covered by Medicare. Nutritional supplements, as we've talked before, are not covered by most insurance. Orthopedic devices are not covered by Medicare. Maintenance or wellness care visits are not covered by Medicare. Non-covered items may go on to your Medicare supplement if you have one, and they will pay according to the terms of your contract. Supplement policies typically pay on fees only approved by Medicare. However, every policy is different. I have been in practice since 1981, long enough to see many changes take place with Medicare. I have never seen this much government regulation through Medicare that forces practitioners like myself to run our office in a manner that we may not agree with. Surveys show that approximately 75% of Medicare patients are confused about their benefits. I would say it's about 90% when it comes to chiropractic benefits, and that includes chiropractors as well. The reason? If we have a question about Medicare and call them, we can ask 3 different people the same question and get 3 different answers. So, what does all this boil down to? Medicare guidelines require the patient to have a treatment plan with a goal of care to show improved function. I strongly encourage you to pay attention to the normal everyday activities that aggravates your pain and report to us when you enter the office so we can properly document your condition and use Medicare benefits properly. The goal of care is determined from outcome assessment questionnaires and the chiropractic PART examination. When the endpoint of care is reached, the patient is discharged from care. If a patient only comes in once in a while to have treatment to control pain, Medicare will call that maintenance care and will not pay. If that is the case, we would have you sign an ABN form stating that Medicare will not pay and you will pay out of pocket for treatment. The fee for this treatment would be $25. Remember, it's cheaper for them if you stay home and take Tylenol. For some existing patients and other patients who have been to other chiropractors, this may be a change in how you utilize chiropractic with Medicare. Our most common out-of-pocket expenses for Medicare patients are listed here. The PCD program is the medical discount plan that we have to have patients join to give them a discount. Thank the insurance industry for this. New patient exams, established patient exams, laser therapy, and adjustments not covered by Medicare are listed below that. Common out-of-pocket expense for the patient is $60 to $120 for the acute care plan or $30 to $60 for the acute flare-up of a chronic condition care plan. These fees may vary depending on whether or not a patient has a supplement policy or is a new or established patient. People's perception of what we do is sometimes hard to overcome. I constantly strive to make chiropractic care safe and effective by utilizing advanced procedures to get the best outcomes for patients, especially those over the age of 65. These procedures may not always be covered by Medicare. However, I will not let any insurance company dictate to me which types of therapy are good for patient care. This presentation is simply designed to inform you of the services not covered by insurance. Also, I want you to understand that your information is kept confidential between the third parties that you designate us to send your information to and our office. Thanks for watching. Be sure and ask questions if needed.